Hi everyone. Today in this video we are going to discuss about Carvedilol. What is this drug Carvedilol? The suffix lol indicates this drug is a non-selective beta blocker, but this drug is also having additional activity. So this drug is having non-selective beta blocker activity along with alpha blocker activity. So Carvedilol is both alpha and beta blocker. Normally the beta blockers are having the suffix olol, but within this name of this drug, we cannot identify the suffix olol. O is not present. Instead, we can take the suffix as dilol. As usual, the suffix lol indicates this drug is a beta blocker, and the term di can be remembered as this drug can act on both of the adrenergic receptors. So along with beta blocker activity, this drug also acts as alpha blocker. So the suffix dilol indicates this drug is a both alpha and beta blocker. Similarly, within the name we can identify the prefix car. This car indicates this drug is having carbazole ring system. So Carvedilol is a carbazole ring containing alpha and beta blocker. What is the use of this drug? This Carvedilol can be used in the management of chronic heart failure, where this drug blocks beta adrenergic receptors, thereby reduce the cardiac work, resulting in the improvement of symptoms in the patients. Similarly, this drug can also be used in the patients with left ventricular dysfunction. Particularly, this condition can be observed after acute myocardial infarction. So, the post-myocardial infarction, the patients may have left ventricular dysfunction with ejection fraction less than or equal to 40%. In such patients, Carvedilol can be given again to reduce the cardiac work as well as to increase the systemic circulation by vasodilatation. And finally, this drug can also be used in the management of hypertension because this drug acts as a vasodilator by blocking alpha receptors. Now let us see how this drug acts. Carvedilol, just we have discussed, it can act on both beta receptors. So particularly it can act on beta 1 receptors which are expressed on the cardiac system so that it can reduce the rate of contraction as well as force of contraction. And when both rate as well as force of contraction are reduced, cardiac work is also reduced. That's why this drug can be used in the treatment of heart failure as well as left ventricular dysfunction. Similarly, this drug can also act on the alpha 1 receptors which are expressed on the vascular smooth muscle. By blocking these alpha 1 receptors, it can produce vasodilatation. That's why this drug acts as antihypertensive. Being non-selective beta blocker, this drug can also act on beta 2 receptors so that it can produce mixed type of sympathetic actions. It can affect the glucose as well as thyroid hormone levels. Now let us see the action of Carvedilol on the cardiac system. On the heart, beta 1 receptors are present which are G protein coupled receptors coupled with alpha beta gamma subunits. When the norepinephrine binds to these beta 1 receptors, these receptors are activated such that they can activate adenylyl cyclase system, AC. Now this adenylyl cyclase can convert the ATP into one of the important secondary messenger, cyclic AMP. This cyclic AMP plays an important role within the cardiac system to produce a contraction. It can activate a group of phosphorylating enzymes, protein kinase A, which are responsible for release of calcium from the sarcoplasmic reticulum as well as increased calcium permeability. By all of these, the calcium levels within the heart are going to be increased. Now this calcium can act on the actin-myosin complex. When the calcium binds to troponin complex, it can remove the troponin such that actin and myosin filaments can slide on each other to produce contraction of the cardiac muscle. In this way, norepinephrine can produce the cardiac contraction, resulting in the increased rate as well as force of contraction of the heart. Carvedilol is a non-selective beta blocker with alpha blocker activity. Because of beta blocking activity, now this drug can bind to these beta 1 receptors expressed on the heart. By inhibition of these beta 1 receptors, it can inhibit the contraction of the cardiac system so that the rate as well as force of contraction can be reduced. In this way, Carvedilol can reduce the cardiac work, thereby it can reduce the angina or any myocardial infarction, and it also improves the cardiac efficiency by reducing the cardiac oxygen consumption. Second one, it can also act on the vascular smooth muscle. Now, vascular smooth muscle is expressed with alpha-1 adrenergic receptors. These alpha-1 adrenergic receptors are again G-protein coupled receptors coupled with alpha-beta-gamma subunits. Now, norepinephrine can again bind to these alpha-1 receptors. When norepinephrine binds to these alpha-1 receptors, it can activate phospholipase C system, PLC. This phospholipase C is a cleavage enzyme which can convert the phosphatidyl inositol biphosphate into IP3 inositol triphosphate plus DAG, diacylglycerol. Now, this diacylglycerol can activate few of the phosphorylating enzymes, protein kinase C, which are going to increase the permeability of inward going calcium channels. Now, the calcium can more enter into the vascular smooth muscle, and IP3 can also release the intracellular calcium so that intracellular calcium levels are increased, which produce contraction of the vascular smooth muscle. In this way, norepinephrine can produce vasoconstriction, thereby can increase the blood pressure. Now, carvedilol is a beta blocker with alpha blocker activity. It can block the alpha-1 receptors so that it can inhibit the contraction resulting in vasodilatation. In this way, carvedilol can reduce the blood pressure. That's why it is used as antihypertensive agent. Now, let us see the precautions of carvedilol. This drug carvedilol can act through the beta-1 receptors, so it can inhibit the sympathetic activity on the heart. As sympathetic activity is reduced, it can reduce the rate of contraction as well as force of contraction. But when this drug is used at high dose, it can produce more pronounced effect on the force of contraction. So when the force of contraction is significantly reduced, it can produce the worsening of heart failure, and the fluids are retained because of reduced force of contraction and reduced capillary permeability. In such conditions, we can give the diuretics such as furosemide in order to counteract this decreased force of contraction, because diuretics can reduce the body volume so that the symptoms of heart failure can be improved. That's why this drug should be carefully used in the high dose and should be started from the low dose, and the dose should be gradually increased. Similarly, this drug should not be stopped suddenly because it can produce worsening of heart failure as well as precipitation of angina because of increased sympathetic activity. Similarly, this drug can also act on the beta-2 receptors which are present on the respiratory system. So, by blocking these beta-2 receptors, it can reduce the bronchodilation mediated through the beta-2 receptors. So, this can result in the bronchospasm in the patients, which is common with most of the non-selective beta blockers. And particularly in the patients with chronic bronchitis, bronchial inflammation or emphysema, in such conditions, this bronchospasm is more pronounced with use of carvedilol. Similarly, carvedilol, by action through the beta-1 receptors, it can block the sympathetic activity on the heart, thereby it can reduce the rate of contraction, resulting in the bradycardia as one of the important effects in the patients. So, the pulse rate is going to be reduced in the patients, and when this pulse rate is going to be reduced by 55, then care should be taken and the dose of the drug should be reduced. Similarly, this drug can block the alpha-1 receptors so that it can block the sympathetic action on the vascular smooth muscle, resulting in vasodilatation and hypotension. So, hypotension is another important precaution that should be considered with this carvedilol, and it can produce sometimes postural hypotension. So, care should be taken when this drug is prescribed, particularly at high dose for longer periods. Catecholamines like epinephrine and norepinephrine can control the glucose levels. They can act on the liver such that they can produce hepatic glucose production. So, sympathetic system can increase the glucose levels. Similarly, they can also block the insulin release, and when insulin is not released, it can further increase the glucose levels. In this way, catecholamines can increase the glucose levels. Now, carvedilol can block the actions of catecholamines, thereby it can produce a sudden hypoglycemia in the patients. So, care should be taken in the diabetic patients where the action of oral hypoglycemic agents are more pronounced with co-administration of carvedilol. But at the same time, this drug can also produce fluctuations of glucose levels, and even it can produce hyperglycemia in few of the patients. Similarly, carvedilol can increase the thyroid hormone levels, resulting in the thyrotoxicosis, and it can also increase the risk of pheochromocytoma. This is a condition of adrenal tumor, where it can produce severe hypertension due to release of catecholamines. Carvedilol can block alpha-1 receptors, but still it can increase the risk of pheochromocytoma. Similarly, this drug can also increase the risk of peripheral vascular disease, even it is having alpha blocker activity. So, a fluctuation of any inhibition may result in increased risk of pheochromocytoma and peripheral vascular disease in the patients. Now, let us see the side effects of carvedilol. This drug mainly produces few of the side effects such as bradycardia, hypotension, fatigue, syncope, hyperglycemia, and sometimes it can also produce hypoglycemia, diarrhea, dizziness, headache, asthenia, lack of energy, weight gain, increase in the weight of the patients can be observed with this carvedilol. Now let us see the chemical nature of this drug. So this is the structure of carvedilol. Just like other beta blockers, this carvedilol is also having the same side chain which is attached to an aromatic ring system. So let us give the numbering to the side chain. This is 1, 2 and 3. So simply it is a propanolamine attached to the aryl group. So carvedilol is again aryl oxypropanolamine. Now the amine group is present at the third position, so we can write this as 3-amino, and OH group is present at the second position, so propane 2-ol. So 3-amino propane 2-ol is attached to aryl group, so it is a aryl oxypropanolamine. But now this nitrogen of amine is having ethyl side chain, so we can write this as 2-ethyl, and this ethyl group is having a phenoxy chain along with a methoxy group at the second position. So it can be represented as 2-methoxyphenoxy. So that is a chain present on the amine group of the nitrogen. Similarly, the aromatic ring system is nothing but the carbazole, which is attached at the first position. So 1-9H carbazole 4-yl oxy. It is attached to the side chain by fourth position. So that is the complete name of carvedilol. So carvedilol, just like the other beta blockers, it is a aryl oxypropanolamine derivative. How it is given? This drug is available as tablet as well as capsule. As a normal tablet as well as film coated tablet it is available, and this drug is available in the different strengths starting from 3.125 mg, then doubling of this strength 6.25 mg, 12.5 mg and 25 mg. Doubling of the strengths can be observed in the different types of tablets, and the dose of the drug depends on the type of clinical indication. In case of heart failure, this drug is started at a low dose of 3.125 mg given twice daily. But in case of hypertension or left ventricular dysfunction, this drug can be used at initial dose of 6.25 mg, again given twice daily, and in both of the cases the dose can be slowly increased such that the maximum dose 25 mg can be achieved, and the dose adjustment should be done after 1 to 2 weeks of the treatment. So that's about this drug carvedilol, which is a non-selective beta blocker with alpha blocker activity. This drug blocks the beta receptors such that it can reduce the cardiac work, resulting in the decreased rate and force of contraction. That's why bradycardia is one of the important precautions that should be considered with this carvedilol. And it can also block alpha-1 receptors, resulting in the vasodilatation, leading to hypotension in the patients. That's why this drug can be used as antihypertensive agent along with other drugs such as diuretics. So that's about this drug carvedilol. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.